Commissioner Hamburg, despite your assertions at the last hearing that FDA really doesn't know how many compounding operations were out there because they didn't have access or didn't have register with the agency, FDA has recently embarked on a sweeping risk-based inspection campaign targeting approximately 50 facilities, primarily of large-scale compounding operations. Is that right?
That is correct, but
Okay,
it's not
good.
because they have
Commissioner Hamburg, then in your opinion, how many of these companies have been operating in the shadows?
We targeted these inspections. About 31 of those inspections were surveillance. Others, the rest of them were for cause when problems were brought to our attention. But we targeted them based on information that had come to us about concerns that they were making sterile products. But that is not an adequate approach when it comes to really being able to have a regulatory system that enables us on a routine basis to go in and do inspections, and as I said, to work in a way with the companies so that problems can be prevented.
So how did you determine which facilities to inspect?
It was a risk-based determination using information from different sources.
So it's safe to say then that many of these companies had long been on the agency's radar, correct?
Some of them had been. Some of it was based on what states had told us. Some was public information from the media.
Public information from the media. Had you received event reports? I think that's what we call it earlier. Had you received reports from?
I don't believe we had for all of the facilities that we inspected. I'd have to go back and ask.
Well, what I'm trying to figure out is you didn't choose to inspect NECC, and you didn't choose to inspect Ameridos, but you chose to inspect all of these others, and you don't even know whether or not there were event reports associated with them. So what I'd like, if you would take this for the record, to provide this committee with all the complaints that the FDA has received associated with their products and practices, because I think the committee could be enlightened by what your standard or what your water level is to determine who you're going to inspect and who you're not. I would like to see that, and I think many of my colleagues here on the committee would. That would be edifying to us, because there's a real because I'm sort of alarmed by what you just said, that many of them did not have event reports.
It is not required for these facilities
I didn't say
to provide us with it.
I didn't say it was required. That's a judgment call, apparently, on who you inspect and who you don't. And you made the decision not to inspect NECC or Ameridos, but you chose then, since the outbreak, to inspect these other 50. I want to see what the criteria is. What causes you enough alarm to want to go inspect? And if event reports that say public health is in danger and that lives are in danger, if that's not enough, I'd like to be able to understand that.
Well, what I'm saying to you is that we need to have a system that actually requires these compounding pharmacies to register with us so that we will know
we're not talking about the ones that didn't register. We're talking about the 50 that you chose to inspect.
We chose
what was the criteria
in lieu of having information that we think should be part of a strong and meaningful regulatory scheme going forward.
But what was the criteria used, and how does that balance against the criteria of the multiple event reports that you received on Ameridos? Can you take that for the record?
We can certainly take that for the record, yeah. And I think this goes to the heart of some of our concerns about what we need to do to have the kind of safety net in terms of regulatory.
Well, the heart of my concern is the judgment. The heart of my concern is the judgment used by the FDA to decide who to inspect and who not to inspect. And based upon your testimony here now, I have even further questions about that, because you just said that many of the new 50 that you're inspecting did not have event reports associated with them. So I'm really confused how, with as much advanced notice and concern that you had about Ameridose, that something didn't trigger with your organization, and you said the buck stops with you, how that did not trigger something at the FDA